First-year doctors in a new family medicine residency program in Bloomington are honing their craft using high-tech simulations. The residents at OSF St. Joseph Medical Center recently completed 2 simulations in the program, intubation and practicing placing a central line. WGLT student reporter Emily Bollinger was there and reports that the simulations help residents feel more comfortable before working with a real patient.
OSF St. Joseph's Family Medicine Residency Program is only about 6 months old. First-year resident Keenan Brown says he is excited to be a part of it.
There's something inspiring about being part of something that's brand new and that's going to keep growing, and that the way we show up every day is going to impact the future of the program. So that's something I really appreciate about it.
Brown says most of the residents have probably done simulations similar to the ones they performed 2 weeks ago while in medical school. This was their first time doing a simulation while in residency. The simulations were provided by Jump Simulation in Peoria. The medical director at Jump Simulation, Lisa Barker, says this is an exciting opportunity for the OSF St. Joseph's medical residents.
So the 2 procedures we did today have risks associated with them, and that's what simulation allows. It allows the residents and even practicing clinicians to practice their skills and maintain their skills in a perfectly safe environment to ensure the best patient care.
Barker says Jump Simulation focuses on clinical education.
Our vision is to improve clinical care, so to have improved healthcare outcomes, which everyone could get behind.
Dr. Rick Anderson is program director for the Family Medicine Residency Program at St. Joe's. He says performing intubation and central line insertion can be risky on real patients.
I think the simulators that they have right now are so realistic that for residents to be able to practice on those mannequins and be able to do those procedures, it makes them much more comfortable when they actually have to do one on a real patient, and much safer for the patient as well.
The first simulation, intubation, involves putting a breathing tube down a patient's trachea so they can breathe. The tube is connected to a ventilator. The other simulation performed was inserting a central line. That's when a catheter is put in a large blood vessel, typically in the patient's neck. Anderson says it varies on how quickly medical residents master the procedure. It typically takes 3 to 5 tries before feeling comfortable.
There's not a lot of pressure on a simulator because you really can't hurt the simulator.
The residents who perform the simulations are being trained in family medicine. They don't perform major surgeries.
They basically do the full gamut of primary care, especially in an area where those specialists aren't available.
Programs like this chip away at a nationwide physician shortage that the American Medical Association recently called a public health crisis. That comes after a pandemic that drove many healthcare workers to retire or quit. Medical resident Keenan Brown says he got into family medicine while reading about global health and learning about social determinants of health.
I think family medicine and primary care is where there's some of the greatest need in medicine. And it feels like a place I can make a big impact. And I like getting to know people and having those relationships.
Brown is already building those patient relationships through Chestnut Family Health Center on Bloomington's west side. Every week he sees new patients and has returning ones. Brown says through Chestnut he has been meeting the needs of a lot of the population in the area who might not have very good access to primary care otherwise.
We have homeless folks there too, or recent immigrants who are still getting settled here, people whose insurance situation is complicated, people who haven't gone to a doctor in many years. You get a bit of everything.
I'm Emily Bollinger.
There are 6 medical school graduates in this first class of family medicine residents in Bloomington. The program is funneled through the University of Illinois College of Medicine, Peoria, similar to other OSF residency programs.
Support for WGLT health coverage comes from Carle Health. You can count on Carle as your partner in healthcare. Information at carle.org.